Hello and welcome to this brief presentation about one of the most important things you can do during your hospital stay. Clean your hands and ensure that everyone coming in contact with you does the same. Most of us grew up with constant reminders to wash our hands. So why hear about it now? Well, hand hygiene is one of the most important and easiest things you can do to avoid spreading germs. Germs that can make you and others sick. The length of stay for patients who acquire an infection while hospitalized is significantly longer than the stay for those who don't. Longer stays due to infections add to the financial toll of healthcare costs. It's a fact that healthcare-associated infections, referred to as HAIs, affect 5 to 10% of hospitalized patients, resulting in a staggering 1.7 million infections every year. But it's not as easy to quantify the pain and suffering, loss of wages and productivity, and hardship on families associated with these infections. Two common germs that cause healthcare-associated infections and are targeted for prevention are methicillin-resistant Staphylococcus aureus, or MRSA, and Clostridium difficile, also referred to as C. diff. A study on the frequency of MRSA colonization on various patient body sites showed that 40% of patients have bacteria on their hands and wrists, while 39% have resistant bacteria in the groin area, and 51% of patients have it on their foreheads. Improving hand hygiene behavior is a key preventive measure for both of these infections. In addition to hand hygiene, the Centers for Disease Control and Prevention recommends close attention to cleaning and disinfecting frequently touched surfaces that are likely to be contaminated with germs, such as doorknobs, surfaces surrounding toilets in patient rooms, and bed rails. Many governing institutions such as the CDC, the World Health Organization, and the Joint Commission have implemented programs to encourage patient involvement to fight the spread of infections. The Joint Commission publication, Speak Up: 5 Things You Can Do to Prevent Infection, is written for patients to understand simple measures they can take to avoid getting infections. It is not surprising that the first measure discussed is hand hygiene. In the WHO's Guidance on Engaging Patients and Patient Organizations in Hand Hygiene Initiatives, healthcare organizations encourage healthcare workers to assist in educating patients and raising awareness of hand hygiene in healthcare settings in a variety of ways. One example is to produce patient information resources outlining the why, when, and how of hand hygiene and its role in the reduction of healthcare-associated infections. Hands can be cleaned using either soap and water or an alcohol-based hand sanitizer, depending on the situation. You're about to see hand washing and hand sanitizing techniques to help you keep your hands clean during your hospitalization. You'll also see the role that your visitor should play in helping protect you. Let's look at hand washing first. According to the CDC, hands should be cleaned with soap and water if they are visibly soiled or after contact with spores, such as those shed in the stool of a patient with C. diff. Here is a simple and effective hand washing procedure that the CDC recommends. First, wet your hands and apply soap. Next, work the soap into a rich lather. Remember to work the lather onto the backs of your hands and between your fingers. It's also important to work soap onto the fingertips and under your nails. These are places where germs can hide. Wash for at least 15 seconds before rinsing. Rinse hands well under clean running water at a comfortable temperature. After the soap is completely rinsed off, gently pat your hands dry with a clean, dry paper towel. Finally, turn off the water using a clean paper towel so you don't contaminate yourself with germs on the faucet. When your hands are not visibly soiled, the CDC recommends sanitizing your hands with an alcohol-based hand sanitizer. For patients, alcohol-based sanitizing hand wipes are also appropriate. According to the CDC, an alcohol-based hand sanitizer is the most effective agent for reducing the number of bacteria on hands. It's recommended for routine decontamination of hands, except when hands are visibly soiled or after contact with spores. Then soap and water is recommended. Hand sanitizing products should be within reach when you're confined to a hospital bed. To use an alcohol hand sanitizing wipe, take one wipe from the packet and thoroughly wipe your hands, including the back of your hands, between your fingers, and underneath your nails until the wipe is dry. Repeat as necessary with additional wipes. Discard hand wipes when finished. If you're using a hand sanitizer, first put a thumb-sized amount of product into the palm of your hand. Then rub your hands together, including the back of your hands, wrists, between your fingers, and underneath your nails. These are the places where germs hide. This should take you about 15 seconds. There's no need to dry your hands because alcohol-based hand sanitizers evaporate quickly. The Joint Commission recommends that patients clean their hands before touching or eating food, after using the bathroom, changing a diaper, playing with a pet, or visiting someone else who is ill. Now you've seen 2 step-by-step techniques to ensure healthy hand hygiene and reduce the spread of germs that can cause illness. But you're not the only one who should practice good hand hygiene during your hospital stay. So should your visitors and the healthcare workers who care for you. Visitors can transmit germs upon entering a hospital facility and after touching the same environmental surfaces as patients and healthcare workers. They should be provided opportunities for hand hygiene in the lobby and the patient's room to protect themselves and their loved ones. Now take a moment and look around your hospital room. Are hand hygiene products within easy reach? Don't be afraid to ask for the products or assistance. As a patient, you should maintain the same good hygiene habits you have at home. And don't hesitate to remind your healthcare workers to clean their hands. Remember, good hand hygiene is important for your health and the health of the people around you. It's that simple. So, clean your hands.